Kuzapula, I'm Tejtema, a senior journalist with Consella. And today in this question and answer session, we have a very important guest, someone who is very renowned, who doesn't need an introduction. He is Dr. Sonam Jamtsho, Bhutan's, I don't know if if I'm right to call if he's the first neurosurgeon. However, he will rectify about this. So welcome to the show, Doctor.
Thank you.
And before we start with the question and answers, if you could briefly introduce yourself so that our viewers can know a little bit more about yourself.
First of all, thank you for having me here. My name is Sonam Jamtsho. So I did my undergrad from Thailand, meaning I did my MBA from Thailand, and after that I did my fellowship in neurosurgery from Thailand. So apparently I'm a board certified neurosurgeon. So I got board certified from the Royal College of Neurosurgical Surgeons of Thailand. So technically, in Bhutan I am the first board certified neurosurgeon, but I have one senior, so who have done a neurosurgery too. So from civil side, I'm the first one.
Wow. So doctor, if you could also share with us, what inspired you to be a neurosurgeon?
So if I'm to talk about my journey in neurosurgery, when I was doing my MBBS in Thailand, so when I was in the 4th year, I got to assist my professor who was a neurosurgeon. The first time I got into the neurosurgery, and I scrubbed in and got this assistant, I got goosebumps. So that was the point where I just felt that this is for me. I wanted to become a neurosurgeon. And secondly, to further get motivated and inspired it was during the time when I served at Gangnam Hospital in 2014 and 15. So when His Majesty visited the Sakteng and Mirakin Sakteng, I got to be part of the team. So at Sakteng, I was checking the patients at the Sakteng community. So that time His Majesty visited the medical camp, and he walked towards me and he was asking me who am I and where I was working and stuff. And there's one question he particularly asked me, and he asked me, what do you plan to become in the future? Then I, with due respect, I replied to His Majesty saying that I'm planning to become a neurosurgeon in the country. And then he patted on my back and said, good, we need one in the country. So, and he patted my back, and when he said that we really need one in the country, that's when my motivation level jumped from this to this, and then it truly inspired me to be a neurosurgeon. And hence, from that day onwards, so thing is, I got a dual scholarship from the government and from Siraj Hospital. I completed my master's the fellowship in neurosurgery from Siraj Hospital. Then I got a dual scholarship and I went to study down there.
Wow, a very remarkable journey. So doctor, at the same time, if you could also share us the neuro services that was there before you joined JDW, and after you joined, what were the services that were introduced?
Thing is, neurosurgery is really big. So it's very vast, to be honest. So in neurosurgery itself, there's 9 services. The first one is neurotrauma. Then there is a pediatric, something to do with the abnormal diseases in the children's. Then there is a cerebrovascular, something to do with the abnormal blood vessel or stroke or something like that. Then there is a peripheral nerve surgery, all to do with the nerve lesions, nerve tumor, nerve traumas and all. Then there is a pain surgery where patient have some kind of a nerve pain, facial pain, where we do surgery. Then you have skull-based tumor. Skull-based tumor is something very complex, where there's a tumor at the base of the skull, around the brainstem, at the origin of nerves in the brainstem. So it's one of the big branch. So it's skull-based. Then you have spine. Spine can be divided into trauma, tumor, and degenerative. Then you have function neurosurgery. Under function neurosurgery, there's epilepsy and there's movement disorders. Then there is there's a neurointervention. So in at all, total there's a nine neurological service in the neurosurgery itself. So when I joined in 2021 June month, I would say that time the neurosurgery service I started in the country, but it was at the basic level. So like basic neurotrauma cases and basic tumor removals were done. So I started off from that base level. So if I have to talk about the challenges, so there was only one neuroscrub nurse, a nurse who should help us in surgery. There was one neuroscrub nurse. There was no neurosurgical ward. There was no neuro ICU. There was no neuroanesthesiologist, and there was only one dysfunctional old microscope and some basic equipment. So I started with that. So until the end of 2023, I was doing all the surgeries with that basic equipment and that limited human resources.
Interesting. And then, you know, like over the span of 4 years, you have conducted a lot of surgeries, Mola. And if you could also share on this, like what kind of surgeries you have performed, you know, and the mortality rate, and also if you could also share with us what kind of cases are referred,
Okay.
and also why,
Okay, definitely. Thing is, when I started my journey as a neurosurgeon in JDW, so back in my head, I always had a goal, or I term it as a neurosurgical project for myself. In that project, I have 5 goals. The first one is like I intend to develop a center or establish as a neurocenter which will cater advanced neurosurgical services, and there's a constant upgradation of skills and human resources. That was first goal. Secondly, within that center, second goal was to increase the survival rate of the neurosurgical case in the country by more than 80%, then decrease the mortality rate by 20%. That was second goal. Third was to reduce the neurosurgical burden referral outside, because there was so many cases that has been referred outside and it's causing a huge loss of budget from the country. So I wanted to reduce the economic burden of the country by reducing the referral. That was second goal. Third was I wanted to kind of provide a very effective basic neurosurgical training for the resident, general surgery resident in the postgrad programs. And fourth was to collaborate with the high esteemed like neurosurgical institute outside and upgrade the human resources. And the fifth goal, the final goal, was to maybe in future plan to develop have our own in-house neurosurgical residency program and produce neurosurgeons. So that was my goal. So coming in this 4.5 years, honestly, I could not develop the neurosurgical center because of so many. Right now we have infrastructure problems and human resource problem. But from there, the goals of increasing the survival rate of patient more than 80% is fulfilled. The mortality rate stands at 5.8%, which is as per my goal. Secondly, there's a 95% reduction in the referral rate of the neurosurgical patients outside. So that goal has been fulfilled. Thirdly, I'm adjunct faculty of a postgrad program in Tejum. So I teach my residents the basic neurosurgical procedures and teach them so that when they get posted at different parts of the country, they can do some emergency basic procedures. Then at the same time, so I started collaborating with the Institute of Past Surgery Neurosurgical Division. Like I constantly kind of invite my professor. Like long time back, I did a skull-based neurosurgical skull-based camp. So I invited the professor to come here and conduct the surgeries on the Buddhist patient. This is going on. The only thing that is left to do is like the first foremost goal to develop a center in the future and then establish a neurosurgical residency program in the country. So we will have our own in-house neurosurgeons.
Okay.
And I forgot to say that.
But the refer cases,
Yes.
like what kind of cases?
In that 4.5 year span of time, I think I have done almost like 1,742 or 45 cases of surgery till now. So from there, 421 patients were referred. So in the number of from the, like I told you, if you go to the new 9 core neurosurgical services. So when I joined, there was only like neurotrauma services, basic surgical services, neurosurgeries were done. So from there, I started 8 new services. This includes pediatric, advanced. These are all advanced services: pediatric, advanced neurosurgical services, skull-based services, pain, peripheral nerve surgeries, skull-based, right? So brain stem surgery is all done here. Then on like spine surgery is done here, and then in the functional neurosurgery, I started doing the epilepsy surgeries. So only thing that was not started was the neurointervention, where it is another big field. So if I'm to explain about the neurointervention, it is like in cerebrovascular, we have an aneurysm, abnormal vessel in the brain, where it ruptures. That conventionally, we as a neurosurgeon, we cut open the skull, go to the blood vessel, and we clip from outside. We call it clipping of aneurysm. But in neurointervention, it is same like the cardiac intervention, whereby like this same particular aneurysm, they don't clip. They go through the artery with a guide wire, and in a cath lab, they go to the lesion and then they just block it from inside. So that anything to do less invasive and using a cath lab is known as neurointervention. So this is a huge one field is there. So this is not here. So currently, the maximum referrals it goes for any cases that requires a neurointervention. If any case is requiring neurointervention, we refer it outside. Secondly, the number of cases that refer is the epilepsy cases, because we do not have a neurologist in the country. And then, but good news is we are soon going to have from January. So for epilepsy, we have to work in coordination with a neurologist. At the same time, we need so many high equipments to detect the source of seizure. It's not here. To work up, I send to India. Then surgery is done here. So that's one referral. Thirdly, is like any cases that require like for function neurosurgery, like that requires like movement disorders like Parkinson, essential tremors. They all require like neuromodulation surgery, like deep brain stimulation and all. These are referred to India. Fourthly, is all cancer cases which require chemoradiation therapy is referred to India. And sometimes, if you look at the place of work, I work in JW, right? So Mongar and Doethang, so they do not have neurosurgeon. They have a CT scan. Daytime, if suppose I get a consultation saying there's a bleed in the brain, okay, there's an emergency case. Daytime is okay for me. I can just activate the airlift. From the chopper, the patient can be airlifted to Thimphu and immediately I can do the surgery. It takes like 30-40 minutes at the max. But the same patient, if it's consulted late at night, imagine traveling from Bongo to Thimphu. It takes 2 days and 1 night. So there were instances where the patient died on the way. Time is very limited. So it's something to do with the brain. Then you have one patient at Doethang, let's say. Daytime, same scenario. But nighttime, if I tell to refer the patient from Gelufu or Doethang to Thimphu, it takes more than 7 hours. In fact, like more than 24 hours. The time is limited for that patient, and so it's not able to do in the country. It's not able to do here in JW, but it's about the time that is required to reach here, where the patient dies. So there were so many instances where like a patient died on the way. It's so sad. So looking at that, the time scenario. So sometimes if I feel the patient requires an immediate procedure, it's referred to Guwahati. So from Mongo to Guwahati, it just takes to bypass almost 5 to 6 hours. So it's better for me to refer from Mongo to Guwahati or Devsong to Guwahati than to here during the night time. But daytime is, if the chopper is available, it can reach at right time, I just refer here. So sometimes there's other factors where I have to refer abroad, like outside. But having said that, these are some occasionals. But the other factors that I mentioned above, these are things which I can't stop right now because we haven't started the services.
Yes. And also at the same time, like you have talked to us about the services that are already there, currently there. And if you could also talk about the future plans, so what are the services that are going to come in, and do you foresee any challenges?
So recently I went to Nepal for an international conference. So there was almost like 200 plus neurosurgeons from all over the world. So from Bhutan, I was just there. So I did a presentation regarding the services that we have in the country. When I did the presentation, and when I saw the presentation that they did, I would say like, there are so many things to be done. I just feel this is not enough. There's a long way to go. Maybe they are here, we are here. So we need to go from this to this. But it's not impossible. It is possible. It's just a matter of time. So I do have a link with the great neurosurgeons of the other countries. So they're keen to help us, help our country to develop the neurosurgical service, be more advanced. So I did some training on regarding function neurosurgery also. So my next plan would be the immediate plan that I have to start a new service is under the field of function neurosurgery for epilepsy surgery, movement disorder, right? But then again, to tackle the complex epilepsy surgeries and some complex tumors, there is one service known as awake brain surgeries, where we do the surgeries with patient wide awake. So this particularly is done to prevent the, let's say, damage the sensitive areas in the brain. So this is the new service that I'm intending to start, maybe in 2 to 3 months. Hopefully, all things that I require I'll get it. So I'm hoping to get it. So that would be my immediate new service for the people. And then down the line, yes, then there's a plan for expanding the function neurosurgical services. For example, like Parkinson's disease, like movement disorders, like hand movement disorders, like dystonias and all, where they require sophisticated treatment through like deep brain stimulation or radiofrequency lesioning. So these are there in the pipeline. So the immediate new service would be the awake brain surgeries for the epilepsies and complex tumors.
So, doctor, if the rumors are to be true, like I got to hear from my sources that given your remarkable medical journey, I heard that you got an offer from international hospitals abroad, offering you a very lump sum, very flat check. In fact, So, what made you not to go, la? What made you stay back, la?
Honestly, I did get an offer from across the border, like maybe 2 to 3 hospitals. I won't name the hospitals, but yes, the money they offer is really good. But the thing is not even the money all the time. So if I look back at the journey where I'm a neurosurgeon right now, right? So I owe this gratitude to the king, to the government and the country. My take is that you might be the brightest student or you might be the most hardworking student in the school. You might have topped every exams. But if the government has not provided you the scholarship, right now you won't be calling yourself as a doctor or anything. That's how I see it. So my take is like, I became a doctor because of we Buddhists are really kind of, we're very lucky. Everything's free for us. Free education, free health, right? So because of free education and free scholarship, I became a doctor. I got a scholarship, I became a neurosurgeon. So I got to fulfill my dream. Now, thing is, of course, Bhutan is a country, our home, right? So there's no other best place to work than our own home. And currently, if you look at the way our Dharma King is working, you just need to get motivated with how our Dharma King is working. And we are not even like a drop of water in the ocean. So what we do is nothing compared to what our His Master is doing. So keeping that in mind, what I feel is like, one is I'm grateful to be born as a Bhutanese. Secondly, I got free education, free healthcare because of our great kings and the government. And now when I'm at this stage, I find happiness in serving my own countrymen and my country. I might not be making a big difference, but even a small difference can bring something for my countrymen, our king and the country. I'm happy about that. Thinking that in mind, at the same time, my parents are here, everyone is here, I'm happy. So the goal of a life is to be happy, right?
Sure.
So I'm happy with my job. I'm happily working in the place I love, my hometown. So there was never talk about the money. So that opportunities come in the future. But for me, like I owe lots of gratitude towards the king and the country and the government. So I'm happy. That's the reason why I'm happy with where I am right now. So I don't intend to kind of go outside. But maybe in future, if I need to upgrade my skills and knowledges, perhaps I will go again.
Wow, a very good thought of you. So, doctor, since we are coming towards the end of this Q&A session, what kind of messages you have for the youth and also for those who inspired to be a doctor, messages that you have?
I would say that if someone wants to become a doctor, my take would be like, a parent should not force your kids to become a doctor.
True.
It has to come from yourself, okay? Thing is, to become a doctor is like, you need to deal with the human emotions, okay? And for example, when I sit in the OPD, outpatient department, in a day I have to see like 60 or 70 patients, right? Each patient have a different nature, different natures, right? So you have to know, you have to be patient about it. In reality, it's not a patient who have to have patience, it should be a doctor who have to be patient. Okay, so if you generally do not have interest to kind of interact with the people and hear about the sickness or hope to or have a will to heal them, then doctor is not a place for not a profession for you. So if you're someone who feels really have a feeling sympathy for the people, and you feel happy when you help others, and you feel happy when you heal others, and it generally comes from inside, then this is the right profession. Not just doctors, any health workers. And don't become doctors to become rich, because our country economy is small. We have to understand that, and then accordingly you plan your journey. And but in the life of as a doctor, one thing is I came to realize is that, for example, let's say I have one patient here, I'm a doctor here. When that patient comes to you, and we know, let's say there's a huge brain tumor. From my perspective, it's very easy for me as a doctor to say, oh, you've got a brain tumor, okay? I need to operate that, blah, 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 and I'll set a date for that. But when I see from the patient's perspective, when you see if there's a brain tumor in my head, right, in the brain, it's too much for them to take in. And then at the very first meeting, like you just meet them 5 times, like 5 minutes, right? The patient has to has to agree with us, me or a doctor, any doctor, treating physician, that, okay, I want to do surgery or something like that, right? So in that 5 minutes itself, when the patient says, okay, they agree to do the surgery, the deepest meaning is that the patient is actually saying, I trust you and I'm giving my life to you, please save me. When we interact like this, it's not, we just ask, we are going to do the surgery, yes or no, blah, blah, that's it, right? But the inner meaning is, the deeper meaning is that, I'm trusting you, please don't break my trust. I need you to save me, right? So we as a physician, we as a doctors, what I say is that you should be really kind of careful about the trust that they lay upon you when they meet you for the first time, just for 5 minutes. And that 5 minutes determines the life of the patient. So it is a profession where you have to be really careful, you cannot be careless, and you cannot treat patient like a guinea pigs. So that has to be in you when you choose to become a doctor.
So basically, at the end of the day, it's all about passion. You choose your career based on your passion, not for the sake of just to be someone.
Yes.
Well, on this note, Doctor, at the same time, I would like to ask you this question. In the span of your 4 years career, you have done various kind of surgeries on a small kid, elderly people. If you could, share us about some success stories, like who was your youngest patient, who was your oldest, and how the name itself, neuroscience, neurosurgeon, it's so it's too heavy for me to, understand. So, I'm sure the surgery itself will be very complex. Some might be, according to you, some might be very simple, but at the same time, some might be very complex, where, you might even have to, even some lives are lost in that process. So if you could share us on that, the youngest, the oldest, and all that.
So before I talk about the surgeries, I'll tell one thing. Neurosurgery is like every other specialties. There's nothing special in it. So you have a pediatrician, you have a gynecologist, you have a cardiac thoracic surgeon, you have a general surgeon, and then neurosurgeon. We are all same, okay? It's just that we are like the fingers on the palm, 5 fingers of the hand, right? So basically, when you make a fist like this, all becomes equal, right? So we're all equal. It's just that I've chosen to become a neurosurgeon. One has become a general surgeon. They are specialists in their own field. There's nothing great about that. That I want to clear it out. And secondly, to talk about the surgeries that I've done. The youngest patient that I've done was 3 hours after birth.
Wow.
So when I talk about pediatric neurosurgery, I'm talking about the birth defects. When the baby is, when the fetus is being formed in the womb, right? Sometimes because of lack of nutrition or genetics, the baby during the formation of the brain and spinal cord is not formed completely. So the youngest patient I did was 3 hours of the birth. So there was a huge kind of the medical term is known as occipital anencephalocele. So there's extra growth out here. So basically there's some malformed tissues behind the back of the head. So that tissue was way bigger than the child's head itself. So that was the youngest child that I've done surgery. So I saw those diseases in the book when I was doing my training, but in practically I did here. So for the first time, so under the guidance of my professors. So that patient is thriving really good. She do not have any neurological disorders. She's 3 years, 6 months something, I guess. And then she also have a younger brother. She's doing good. And then that oldest that I've done in my career when I was working in Thailand, the oldest I did was 92 years old in Thailand with a huge tumor at the cerebellum. And in Bhutan, the oldest I did was 88 years old with a brain tumor. And he's thriving. And the longest surgery that I've done in my career is 14 hours here in the country itself. That patient's still living. There was a huge brain tumor. So when I say about sometimes it's like this. The mortality rate, when I talk about mortality rate, is touch wood till now, I never had a patient dying on the table. Touch wood. And I'm thankful to the Jinchusum that everything is going smoothly. But it was only after the surgery that maybe sometimes there's a complications like having an infection or sometimes having a treated like multi-drug resistant organism infections causing the patient to have a breathing problem, lung infection or kidney infection, something like that. These were some of the factors that lead to the mortality, and something to do with the nature of disease itself, the nature of the disease. If it's aggressive cancer, very difficult to treat. When I treat the patients with the brain cancers, I know the surgery has gone well, but I know the patient won't survive. So I don't feel happy when I do surgery, to be honest. I know the patient will live for a few months, but the nature is very aggressive. So such cases, it increases the mortality rate. And then what's next? Coming to the complex surgeries, like the patient having the complex surgery I would say is like the brain stem surgeries that I did here. In other parts of the world, what they do surgeries with navigations or high-end equipment. Here is all my anatomical knowledge, and I go to the brainstem and take out the tumor or the blood formation from there. So typically saying, there's varieties of surgeries that I do here. So the rest of the world, like they further specialize to do particular field, but here I do everything, and with the God's grace, everything is going well. So I hope I can further improve these services.
And I'm sure, by the grace of the God, the whatever plans that you have will be achievable, and you will be able to successfully, build a neurosurgeon center. And we wish you all the best.
Thank you.
And doctor, once again, thank you so much for making time, and then to have you here for a conversation will not only enlighten me, but also our viewers, who are not very much aware of the services that is being offered in the GD. And I'm sure with this video, people will be more aware of the services and will come forward. And in that note, where should they come and see you? If you could also give us, your chamber, or when should they come and visit you?
So usually, my OPD is every Wednesday at the old building, chamber 8. And rest of the days I do on calls, and then I do most of the time I'm in the OT. But sometimes if there's so many patients there, then I do Saturday also I do OPDs and all. So basically at least two days a week I do OPD, but maximum is on the Wednesday. But Saturday I get occupied with the surgeries and all. Then that time I have to cancel the OPDs. So you're going to find me in every Wednesday at Chamber 8, old building.
So that's where the patients can come and see you.
Yes.
Once again, thank you so much, doctor.